So I would say like women of childbearing years, we're talking about reproductive health, things you can do for your body to be more healthy, different options of birth control. We talk about that as well. As far as normal health screenings, it's really just the Pap exam is kind of the big one for the younger women. The mammogram kind of comes in around age 40, so we start having that discussion a couple years probably prior to doing that test. And then around age 40 to 50, kind of perimenopausal, that menopausal change, we're talking about those changes. Again, things that we can do health-wise to make ourselves more healthy during that time period. And then postmenopausal is usually 50 to 52 and after. We're still doing the Pap exam, still doing mammograms. We start talking more about bone health, things we can do to prevent, problems with that. Really, healthy diet and exercise is important really for everybody, especially women of childbearing age. Having a healthy diet, maintaining a normal body weight is really important. As far as blood pressure, you want to make sure your blood pressure is controlled, blood sugar is controlled, because if you were to get pregnant, that can kind of become an issue. Also exercise 30 to 45 minutes, at least 5 days a week. I really try to add that into the conversation as well. Definitely, again, diet and exercise, the metabolism starts to slow down. A lot of women kind of notice that, they're aware of that. It's a lot easier to gain weight. So really, again, focusing on healthy diet and exercising. And if you've developed that early on, it's easier to carry that through. If you're starting that for the first time, and you're in your 40s, it could be a little bit harder, but we are talking about that as well. Blood sugar, blood pressure, the exercise, the diet, family history. If they're a smoker, that can increase your risk for cardiovascular disease, so I'm definitely trying to talk to them to quit smoking. Women can also present differently when we talk about heart disease. They might not have the chest pain or the pressure, the elephant sitting on their chest. They may have more atypical symptoms like abdominal pain or nausea or just not feeling quite right. So their symptoms can be different, and so kind of talking to patients about that or taking more of a history, maybe if they're having symptoms, is definitely part of that. I hate to keep harping on the diet and exercise, but it is so important. So diet and exercise, balance is something too that is often forgot about. So people do the cardiovascular exercise, but they forget to train balance. So Pilates, yoga, any different tapes you can do at home to work on balance, that usually gets worse every year after age 65. And you can actually prevent that worsening through continuing to work on your balance. Falls is a big thing that can happen. No one thinks it's going to happen to them, that they're going to be the person that falls. Balance is multifactorial. It takes our vision, our hearing, our sensation of our feet. There are so many factors that go into balance, and as we age, those can all change. So they're all changing and they're not going in the right direction, unfortunately. And we just use all our senses for balance. So if we're able to train that, and maybe if you do have some vision loss, or you have some hearing loss, or maybe you have vertigo, that all kind of plays into that. So if you're kind of working on all those centers, you're not going to lose your balance like someone who wasn't working on it.